we all collectively believe the same thing.
In this day and age, it's especially important.
Every day, every time we interact with a patient, in the back of our minds, it's always there.
The Hippocratic Oath is often regarded as one of the oldest binding scripts in history. It is a sacred and universally known pledge of compassion and honor. In ancient times, it ensured physicians' moral sincerity and a patient's right to care and dignity. In modern times, the original oath is often seen as an outdated text. While the great sense of honor is still observable within, the Hippocratic Oath has evolved to accommodate today's medical practices and continues to uphold patients' rights and bind physicians to their responsibility of bestowing safe and effective care.
Some people say that the oath is outdated and it's unimportant. I think that it actually is important because it binds students collectively into a group that is now a group of physicians, whereas before they were just a group of medical students.
The Hippocratic Oath was most likely written in Greece by Hippocrates of Cos during late 5th century BC. Although historians are not sure whether or not the oath was written by Hippocrates, it is attributed to the Hippocratic Corpus, a collection of works associated with Hippocrates. Hippocrates was a revolutionary in medicine, and he was commonly referred to as the father of Western medicine. In the time period in which he lived, most illnesses were attributed to supernatural causes, something he rejected. During his lifetime, he made many discoveries much more advanced than his contemporaries. One of these discoveries was his idea of the four humors, or that illness was caused by an imbalance of the body's four core fluids, which, in essence, was the basis for antibiotics. By the time Hippocrates died, he was the most famous physician in Greece. When it was written, the oath was a pledge that showed great knowledge and selflessness in an individual. This person would do no harm to their patient and dedicate themselves to treating said patient to the best of their ability. The oath was lost for around 1,500 years after the fall of Greece, but was rediscovered by scholars in the Middle Ages. It had a slow uptake as the Christian scholars were not very accepting of an oath that called upon the Greek gods Apollo and Asclepius. Nevertheless, it was recorded and used occasionally. Since that time, the oath and the ethos within it have been preserved and taken by nearly all physicians. In more recent times, the advent of practices such as surgery, abortion, and euthanasia have contradicted the oath. As such, some statements in the oath were rendered impractical. Because of this display of antiquity, revised versions of the oath have appeared in order to accommodate new practices. Popular oaths include the Prayer of Maimonides, the Declaration of Geneva, and the Oath of Lasagna. The Prayer of Maimonides was first believed to have been written by Moses Maimonides, a physician and philosopher in the 12th century. However, recently evidence has appeared that supports the idea that it was written by Marcus Hertz, a German physician. A difference in this oath is requesting guidance from God rather than the Greek gods. The Declaration of Geneva was written and taken by the General Assembly of the World Medical Association in 1948. It has been revised 5 times since it was written. This oath was written with the atrocities of the Holocaust in mind. As such, it focuses heavily on the humanitarian practice of medicine and the equality of all patients without regards to race, sex, or religion. The most commonly used oath today is likely the Oath of Lasagna. It was written by Louis Lasagna in 1964. Lasagna was a professor and dean of biomedical sciences at Tufts University. His oath is closely derived from the original oath, and likewise stresses the idea of treating patients as fellow creatures in pain. This oath is considered by many as more appropriate for today's world. While these 3 oaths are the most widely used, there are many others that also all stem from the original oath. Today, almost all medical students must take some form of an oath in order to graduate and receive a medical license.
Do you support medical students taking an oath?
I absolutely do. I think it's important for all medical students to, again, feel part of the group of physicians that they're joining upon graduation. And I think it's important to, even though it's more of a symbolic gesture, for them to voice their support for being part of that group.
Do you find the oath outdated?
I don't. As a matter of fact, I think it's impressive that an oath that was written and devised so many years ago is still pertinent today.
I think it's not so much as outdated as just that the terms could be better defined, to make it more relevant. Where it talks here about wrongdoing and corruption. And what does that mean? Like enticements, when there's financial incentives where you would benefit and the patient doesn't, those kind of things.
The ethos within the Hippocratic Oath have given birth to many of today's medical regulations. The purpose of the vows within the oath was to set clear standards in conduct while ensuring the best possible care for a patient is given. Today, the oath accomplishes that same purpose of preserving patients' rights and doctors' responsibilities. Many modern duties of doctors are plainly derived from the oath. The reason behind this is that the original oath had already set reasonable boundaries.
I think every physician takes it, and we hold each other accountable.
A few statements in the oath say, "I will keep them from harm and injustice." Another adds, "Whatever houses I may visit, I will come for the benefit of the sick, remaining free of all intentional injustice." A modern reiteration of this comes in the form of, "Make the care of your patient your first concern," and another, "Take prompt action if you think that patient safety, dignity, or comfort is being compromised." Another vow based in trust commands, "Remaining free of all intentional injustice, of all mischief, and in particular of sexual relations with both female and male persons." In modern times, relationships between a doctor and a patient are allowed. However, it remains a physician's duty to never abuse your patient's trust in you or the public's trust in the profession. A final vow that may also be the most well-known states, "What I may see or hear in the course of the treatment or even outside of the treatment in regard to the life of men, which on no account must once spread abroad, I will keep to myself." This was the original version of what is now known as doctor-patient confidentiality. Doctor-patient confidentiality is the right given to patients to reveal any information to their doctor. Subsequently, the doctor is forbidden to divulge this confidential information. In legal terms, respect patients' right to confidentiality.
We're not allowed to look at patients' records that we don't take care of. So if you have a friend in the hospital, I'm not allowed to sort of look at my friend's charts. I'm not allowed to look at people's charts. If you were to ask me, suppose we were good friends, he said, "Well, I want to know how so-and-so's doing." An innocent concern question. I have to tell you no. We're forbidden.
These vows have come from the careful consideration of ethics and proper practice. They create the honor and integrity of the medical field. These modern principles are universal and, however simple, have been protecting the dignity and well-being of both physicians and patients for decades.
The Hippocratic Oath had a role in the 1973 Supreme Court case Roe v. Wade. The case against the state of Texas was regarding abortion. 4 paragraphs in the case were dedicated solely to the oath. In 1970, the plaintiff Norma McCorvey, under the alias of Roe, filed a lawsuit against defendant Henry Wade, who represented the state of Texas. McCorvey was pregnant at the time and wished to have an abortion. However, the state of Texas prevented abortion except in the case of rape or incest.
It seemed to us that the fact that the medical profession at one time had adopted the Hippocratic Oath does not weigh upon the fundamental constitutional rights involved. It is a guide for physicians, but the outstanding organizations of the medical profession have in fact adopted a position that says the doctor and the patient should be able to make the decision for themselves in this kind of situation.
Justice Blackmun noted that the oath became particularly popular at the end of antiquity. The rise of Christianity in that time period caused resistance against abortion and suicide to become common. As such, the oath became the center of medical ethics and was accepted as an ultimate embodiment of truth. With the rise of abortion in the modern age, the vow condemning abortion became obsolete. This triggered many revisions of the oath. The Supreme Court later on found the Texas law unconstitutional, thus allowing abortion much more freely. The outcome of Roe v. Wade was a landmark decision by the Supreme Court on the issue of abortion. Today, abortion is thought by many women as a fundamental right, gained in partial due to the role of the Hippocratic Oath in this legal case. The Hippocratic Oath was written at the very dawn of Western medicine. Hippocrates was a genius, with ideas far ahead of his time and a great sense of moral fidelity. Since then, his oath has survived and forged medicine and physicians into what they are today. The oath has represented the rational pursuit of scientific discovery, integrated with patient-oriented care. Although taking an oath is not required legally, nearly all medical students continue to do so. For doctors, reciting the ancient pledge establishes a stronger resolve for honorable care. It has defined proper procedure and protocol in the medical world. It provided a guideline for doctors' responsibilities and the rights guaranteed to patients. As such, the integrity of the medical field might have been very different today if the Hippocratic Oath had not been created.